So we sit down backwards, we sit down butt first, we sit down glutes first, the same way that we climb down ladders backwards. It makes sense to move this way. So the question is then, why do we go downstairs forwards? Why do we go downstairs knees first? It turns out that the main reason we move this way is because everyone moves this way. There are a few advantages. We get good vision and we get good speed, but the disadvantage is it's hard to do this without impact. Clunk, clunk, clunk. Impact is associated with joint pain, joint damage, arthritis. 100 impacts a day makes 100,000 impacts every 3 years, makes 1 million impacts every 30 years. Impacts add up over time. And eventually inability to take stairs, which is problematic to living a long life. But what happens when we turn around and we take stairs backwards? Using our long backwards reach, we're able to take all the impact out of stairs. It becomes a silent thing. It becomes a no damage thing. It becomes a sustainable way to move for many, many, many more years, potentially, additional decades. There is certainly advantage to moving backwards using the rails for balance, and if it makes more sense for you, you can imagine that it's moving the same way up as the same way down. If you find one form that works, use that same form going up as going down. So it's really not backwards, it's just a mirror. So the conventional stairs method of going up and down with a different form and down with the high impact form starts to make less and less sense. Because we sit and we get up with the same form. Same with ladders, we take the exact same form up that we take down. It makes sense, this one form is really good. And everybody's body is different, but for the most part our bodies and joints all follow the same rules. And these rules, for the most of us, mean that it's easier to avoid impact and avoid stress using the same form that we go down as we go up. So I really encourage you to try it, the sustainable butt method over a short-term knees method. See how it feels to you, see how it feels different to you, see if it feels better for your body. If it's not for you, at least you tried it. If it makes sense, keep doing it. I know it's difficult to do things when no one else does that think you're crazy, but they want to know what you're doing, they will ask, and they'll listen to you, and they'll be open-minded when you explain to them why. And this is how it will spread. And it is important that it spreads, because although it is a really minor thing, it's a minor thing that affects all of us, and none of us have really been educated on the options when going downstairs, so it's important that we at least know that we have a choice. Thank you for listening. I hope you find this information useful. I hope you have the courage to implement it, and I hope you have the love and the generosity to share. If you want to help, the first step you can do is take stairs with love for your body.
The knee is a joint that allows for the motion of your leg by bending and extending. It is essential for sitting, walking, and running. The bones that make up the knee are the femur or thigh bone, the tibia or shin bone, and the patella or kneecap. Ligaments, which are bands of tough fibers, hold these bones together. Inside the knee, 2 ligaments hold the thigh bone to the shin bone. The first is the anterior cruciate ligament, or ACL. This is especially important in running and other athletic activities. Its function is to keep the shin bone from sliding forward while you are moving. The second is the posterior cruciate ligament, or PCL. It keeps the thigh bone from sliding forward during knee motion. 2 types of cartilage are present in the knee joint. The first type of cartilage is articular cartilage. This cartilage covers the ends of the bones and provides a smooth gliding surface. The second type of cartilage is the meniscal cartilage. This consists of 2 C-shaped pieces of cartilage that sit between the thigh bone and the shin bone. There is one meniscus on the inside and one on the outside of the knee joint. Each meniscus acts as a shock absorber between the shin bone and the thigh bone. To lubricate the knee, a lining of tissue inside the joint, called the synovium, produces a lubricating fluid. The knee joint is surrounded by a joint capsule that attaches to each side of the joint and helps keep the lubricating fluid inside. There are also muscles, ligaments, and tendons outside of the knee joint that function to stabilize the knee and allow active movement.